But you have to be honest with yourself. I tell this to every medical student, to every potential cardiac surgical trainee. Do you really want to do that?
Yes.
And nobody else can answer that question. And again, I became fond of cardiac surgery only during that tough second year of my training in Sydney.
Yes.
Before that, I wasn't very sure what I was going to do and whether I was in the right place, whether I was doing the right thing. But at some point in time, the knowledge will dawn on you. So yes, if your calling is that you want to be a cardiothoracic surgeon, go for it. These training stumbling blocks will soon be removed. And I'm sure there's no journey like mending broken hearts.
Yeah,
you know?
that's right.
If I may, I want to end up with a quote.
Yes.
And this is my favorite quote from my holy book, the Bhagavad Gita. And the Bhagavad Gita says that every yesterday is but a dream, and every tomorrow is but a vision. But every today well lived makes every yesterday a dream of happiness, and every tomorrow a vision of hope.
Well.
Hope is the currency of the future in the present. My question to you would be, is justice totally blind today? We are a fractured nation that has not healed from its past.
Vision, passion, politics, policy. This is HEARTtalk with Dr. Charles Lee.
Welcome to HEARTtalk, coming to you from Kuala Lumpur, the capital city of Malaysia. You know, if this is the first time that you're visiting this particular website, I want you to do three things: subscribe, share, and like it, because there's no other place than this podcast called HEARTtalk. Now, HEARTtalk is actually a conversation. It's not an interview. It's about heart-to-heart matters that really depend upon you and where you are in this life. And I love to talk about matters concerning the heart. We're talking about wealth. We're talking about politics, policy, everything on kitchen table. And, you know, today is no exception because it's an extraordinary occasion for me personally. So please, I hope you enjoy yourself, and at the end of it, if you like this video, please share it and continue to keep in touch with us on HEARTtalk. The ethical foundation of professionalism in medicine is anchored on the cornerstone of three words: do no harm. And I think it's critical that we understand the breadth of where this has traveled over the years, and to understand this whole world of being a cardiac surgeon. I've taken my introduction from a book written by Professor Stephen Westaby titled Knife's Age. I mean, we are living on the age of life today. It's really a knife's age. And I'm amazed that to understand this whole world of cardiac surgery and what it takes to be a cardiothoracic surgeon, I had to enter into the world of its own. So as an introduction, it's interesting that he writes about the cost of discipling a doctor in this field. Now let me read the preface. Every single heart operation risks a life. This tension between kill or cure is unique to this specialty, with no professional equivalent. And few people can live with it on a daily basis. During my formative years, to operate within the heart was seen as the last surgical frontier in medicine. Each heart is unique in its own way. Although most operations prove straightforward and uneventful, some evolve into an extraordinary battle for survival, and a few, quite literally, a bloody disaster. Now, speaking to an assembly of school children, he tries to share the personality that he had to, kind of recognize to be able to become a good cardiac surgeon. And he writes, I had to convey to them what personal qualities I possessed that enabled me to become a cardiac surgeon. To study medicine, assembled here, demands an unstinting work ethic and great determination. Then it requires more than a modicum of manual dexterity together with supreme confidence to train a surgeon, to aspire to become a heart surgeon and risk a patient's life every time you operate is a step beyond. For that, you need the courage to fail. And so that's my title of today's conversation, The Courage to Fail and a Cardiothoracic Surgeon's Dilemma. Dato Dr. Venugopal Balchand is a leading cardiothoracic surgeon here in Kuala Lumpur. He is a fellow of the Royal College of Surgeons of Edinburgh and has worked as a consultant at the National Heart Centre for 15 years before embarking into the private sector. He holds multiple academic positions at several universities and is the past president of the Medico-Legal Society of Malaysia. Dr. Venugopal chairs a task force in the National Coalition of Mental Wellbeing and contributes regularly his insights into various subjects to the Free Malaysia Today News Portal. So, would you join me to welcome Dato Dr. Venugopal Balchand? Welcome to HEARTtalk.
Thank you so much, and thank you for having me.
Can I call you Venu?
Yeah, just call me Venu.
Listen,
everybody calls me Venu.
I just wish that this conversation was in a pub somewhere, you know.
I wish so too. If you had told me earlier, I might have got permission to have a glass of beer here.
I tell you, it's not too late. But you know, Venu, I had to read the book, The Knife's Edge, by Professor Stephen Westaby, just to enter into your world, because it's different. And there's a cost to it. And I want to start off, I had this question actually in my conversation list of points. Now, you did a case this morning.
Yes.
And you said, look, I can only come in, I've got a quick case. Now, that's work ethic.
Yes.
And so this question I want to put to you right off the bat is that if you had to do it all over again, would you still have chosen cardiothoracic surgery?
Certainly I would, because cardiac surgery has been good to me, all right? And before we proceed, I think the first thing I have to acknowledge is I have had the incredible pleasure of meeting Stephen Westaby in person.
Wonderful.
And watching him operate, because I spent 2 weeks at the John Radcliffe Hospital in Oxford. He is an amazing person, and he has done so much for cardiac surgery, not only in the UK, but in the glory years, you know, they used to travel all over the world and teach people like us.
Right.
And so Stephen is an amazing individual. He's written this amazing book. And I think I would encourage everybody to actually get a copy and read it. Yeah.
Absolutely.
And a lot of what he says is true, because he took the words out of my mouth, in the sense, just before the show started, when I was having a casual conversation with you in the corridor, the first thing I told you is that every single cardiac case is a potential mortality.
Absolutely.
How do you live with that?
Yes.
You know? And so, yeah, it's amazing. I would still be a cardiac surgeon, but I hope not with so much effort that I've had to put in over the years.
I can imagine. I mean, it's a knife's edge.
It is.
Living on that edge of life, you know, and I really want to congratulate you.
Thank you.
And I want to thank you for what you have been doing and have done.
Sure.
Because I'm talking to you today not only as a fellow surgeon, but as a heart patient myself.
Ah, all right.
Okay, so I had open heart surgery 13 years ago.
Oh, all right. Okay.
And so I've got a scar to prove it.
Okay, I won't look at it.
And you know, when you talk about a fellowship and opening a club,
sure.
If I'm waiting for, you know, anywhere and someone's wearing a short pants and I see a scar on his leg, I say, welcome to the club, man. But you know, talking about the knife's edge,
Sure.
I want to talk about, you know, in the ancient scriptures, Venu, the psalmist writes, he praises his God. And then he says, I am fearfully and wonderfully made. Your works are wonderful. And when I think of, in my teenage years, I had a pair of budgerigas, they are lovebirds, Australian lovebirds.
Oh, all right. Okay.
And they're in a cage. And I used to just sit there and watch them loving each other, pecking each other's neck. And one was a pure white albatross and the other one had multicolors. It was fantastic. They were called lovebirds.
Oh, all right.
And I think of the Creator's hand to create a rib cage. And inside that rib cage, He nestles the very source of life.
Sure.
You got the heart that's pumping blood.
Yes.
And you got the lung that's giving the breath of life. I mean, what a majestic creation,
Yes,
it could have been anywhere else in the body.
Yeah.
But He protected it.
Yeah.
And I would think that the cost of discipling a surgical trainee or someone to enter into that space, as Stephen Westaby says, it's a license to kill or cure.
Yes, very true.
Right?
Yeah.
So the cost is very
Though
high.
we cure 95%, 98% of the time, there are a few that don't make it.
Absolutely.
Yes.
So once again, thank you for this opportunity to have this conversation with you, because it's going to open up many doors. And I hope many of you who are listening in will realize the weight of becoming a cardiac surgeon. It's not about the glamour of it. It's the cost of it to be discipled to be a good one. Now, I began this series of conversations called Quo Vadis, Malaysia. It's a Latin phrase for where are you going, Malaysia?
Okay.
Because I was not only puzzled but intrigued that after 60 years of formation and now 61, I say that this is a fractured nation, Venu, unhealed, yet to be healed, and they're still on crutches. And this is a cost today where there's a crisis of identity, national identity, multicultural identity, to be a Malaysian. And I want your thoughts about it, because as a Malaysian of Indian ethnic origin, where do you see this country going?
Well, I think for a start, being Malaysian is an emotion, all right? I think it is more than paperwork, your passport, where you were born, where did you study, what language you do, and things like that. No, it is an emotion. I spent 18 years of my life in India as a student, but I am not an Indian. I am a Malaysian because I was born here, I work here, Malaysia made me who I am, and it is that kind of passion, commitment, and emotion that makes you belong to a particular country. Unfortunately, I think Malaysia is at a crossroads. For various reasons, political or otherwise, there is a big group of people who want a mono-ethnic kind of progress. And that's not what Malaysia is all about. Malaysia is about being a melting pot of very different races. Not only the races, the people between Malaya and East Malaysia. I mean, there is so much of diversity, but all molded into one being. And that is what is very unique about
it's
Malaysia.
It's unique, isn't it?
Yeah, it is absolutely unique. I mean, you are from Sabah, Sarawak. I am from Malaya. Ideally, we should be two different individuals, but we have the same passion for the country.
Correct.
You are worried that it is a fractured nation, that it has not healed. I would be a bit more optimistic to say that just because we cannot see a path forward, it doesn't mean that it is not there.
Yes.
So I just hope that the values of the founding fathers never intended this to be a mono-ethnic nation. I think they wanted it to be a glorious country that would be a kind of a model, a replica for other nations to follow.
Yes.
And I'm sure you agree that maybe on the ground, even today, a lot of people get along very well with each other.
Yes.
If I have performed about 10,000 operations in my career so far, the majority of them are not of people of my own origin.
Yes.
The
Absolutely.
number of Indians I have operated,
Yes.
Indian Malaysians or Indian Indians, is only about 20-30%. So I personally think, and let me tell you, the Malays or the Chinese whom I have operated upon are no less grateful to me. So I think one has to realize that, like you said, when God's creations, Every creation is the same.
Absolutely.
When I go into a heart or the chest, I don't see a different heart in a different ethnic thing. They all beat.
Yes.
They all are the same color. Some are a bit more fatty than the others.
Yes.
Blood is always red, whether it is a Malay, Chinese or Indian.
Yes.
And so I think we need a huge paradigm shift for the country to move forward. The opportunities are there, but unfortunately, the politics is a bit divisive. And I hope that even every single interview like this, for example, would instill in the population the idea that we are one, we are Malaysian.
Yes.
And you asked me about Indian ethnicity in Malaysia. Let me tell you that the majority of the Indians in Malaysia, the vast majority, have not seen India.
Yes.
They have not been to India.
Yes.
They don't know what being Indian is about. They only know what being Malaysian is about. But you have to respect that. There's no point saying that you are one, you are different.
Yes.
No, we're all Malaysian.
Yes.
And I wrote in one of the articles, if Lee Chong Wei wins a badminton medal, I don't look at him as Chinese. I clap as vociferously and as loudly as any other Malaysian. When Mokhtar Dahari, I used to watch Mokhtar Dahari play and he scored a goal.
Yeah.
It didn't matter that he was Malay. It all mattered was that he made Malaysia into a then reasonably good football team.
Yes.
So that kind of thing should be there, you know,
Yes.
and that is what I think being a doctor helps, because you and I, we never take any sides on any race or any ethnicity or any religion for that matter. So that kind of magnanimity in our profession helps us to become better individuals for the country.
No, point well taken, and I feel with you
Yes.
that, one of the times that I felt what it is to be truly Malaysian was when I had my open heart surgery.
Yes.
My heart surgeon was a Malaysian Malay.
Yes.
Another Malaysian Chinese heart surgeon took my veins, harvested my veins from my leg,
Okay.
who is currently now in Penang.
Yeah.
And then it was a Malaysian Indian who extubated me as an anaesthetist.
All right.
So I had all three together,
Yes.
and I said, Malaysia boleh.
Yes.
And, these are the critical times of life.
Yeah.
Like when COVID hit us, nobody was, it was colorblind.
And Charlie, I would like to reiterate this. At any moment in time in Malaysia, there are instances of, say, an Indian doctor operating on a Chinese patient, which is what I just did. The anesthetist happened to be Malay. And this combination of different ethnicities, different races, of different religion coming together to save a life
Yes.
happens every single moment
Absolutely.
in this country.
Yes.
And anybody who thinks that this is not important is being a bit foolish.
Yes.
I think it is so wonderful to see that at least in our profession, medicine, there is very little of anything else.
Yes.
But my worry is that it is leaning in a bit of a political direction.
Well, this is why it takes wisdom to know the end point. And as I said, there are fault lines. Just like countries have earthquakes without even knowing it, but there are fault lines. And if we are not aware that those fault lines can actually blow up into situations which are out of control. And another incident, and I'm sure you will relate with me, was when I was in the army and I did my military service for 2 years. And that was 1981.
Yeah.
I was in the jungles of Sarawak in Bau.
Oh, all right.
Okay.
Okay.
I don't know how many doctors know what it is to hold an M16, you know what I mean? And that night that I was out there, there were two communists. They were shot dead.
Ah.
And on my left was a Malaysian Indian, on my right was a Malaysian, all doctors,
Yes, yes.
And that's why I say that the younger generation forgets that there's a price to keep the unanimity of a single one Malaysia kind of concept intact. Because the days ahead are not going to be easy.
Sure.
And we're living in difficult times.
And I would like to highlight the fact that I served in the army just like you for 2 years.
Yes.
And I was the only non-Malay among 700 Malays because I served with Regiment Askar Melayu di Raja. I was 19 Royal Malays medical officer. But rather than it being something awkward, I am not bluffing when I say that those 2 years with 19 Royal Malay were probably the best years of my professional career.
Right.
I didn't feel left out. I didn't feel, because I used to go and be part of them. I used to attend the Talils. I'll sit in one corner. I might not know how to recite their prayers, but I will just show the respect that I'm supposed to do. And in turn, they respected me. They respected me for being Indian and being Malaysian first. And, my commanding officer was a gentleman.
Yeah.
And I must say, Lieutenant Colonel Hashim bin Yahya, who was then my CEO, commanding officer, he's now retired Major General. If not for him, I wouldn't get the time I needed to prepare for my part 1.
Oh, yes.
He went out of the way and he looked at me and said, "Oh, you want to become a surgeon? Okay, I give you some protected time to study." And on a public show like this, I would like to acknowledge the fact that he was the one who put me on the road. Because without a part 1, you can't get anywhere.
Oh.
And because I had a part 1 and because I served the army, then I got HKL as my posting of choice. And that's where my surgical journey began.
Fantastic. I mean, you talk about passing your part 1.
Yes.
My 2 years in the military service, I did nothing but study one lady who's now my wife.
Well, you did a good job.
Right. She was, a staff nurse in Trendak Hospital.
All right.
So I used to go at 11:30 at night and do ward rounds, Because I was a captain. Follow me, that kind of thing.
Right.
And so we all look back with good memories.
Certainly.
And there's a joy to life, more than one could
Sure.
entail for and ask for. So moving on, William Bridges is an American author who wrote the book Transitions,
Okay.
Making Sense of Life's Changes. And he talks about 3 phases in life, Venu. The ending, and then there is a neutral zone, and there is a beginning. So let's go back to your early years, where you did your medical school, and then you went into your training, and then it came to an end, and during that neutral zone, you started to decide whether I'm going to do cardiothoracic surgery or not.
Certainly.
So where was the early years growing up? I mean, in med school.
Yeah. So I think I was the first batch of Malaysians. In 1967, they changed the medium of instruction from English to Malay.
Right.
So when I entered Standard 1, I would have done my whole education in Malay. But those were the very early years, so a lot of non-Malay parents were not sure what was happening. And so I was one of 70 7-year-olds aboard SS Rajula going to India for an English medium education.
Right.
So I did all my schooling in Kerala, Trivandrum, under the watchful eyes of my uncle, who made me who I am today, Mr. K.S. Menon. He was an IAS officer. And being an IAS officer, he only was interested in 2 things, study and sports.
Right.
Nothing in between. So I was a very good cricketer. I spent all my time either with books or with games and being physically fit and things like that. And then I did my medicine in Madras Medical College because I was very fortunate that I did well in my pre-university and I got the necessary grades to get in. Madras Medical College is the 2nd oldest medical institution in India and very prestigious, very difficult to get into. But I was fortunate, and then I came back, did my housemanship in Malacca, where you found your wife, but I was not so lucky. And then did my army, and then came to HKL. And, sometimes life is full of quirky coincidences. So when I came to HKL, of course under Dato J.C. Mehta, the then head of general surgery, for you to go and become a surgeon, you need various rotations, right? So the only vacancy was in cardiac surgery.
Right.
So my first rotation was in cardiac surgery under the now Tan Sri Yahya Awang. And guess what? Our former Prime Minister, Tun Mahathir, he needed a bypass operation in 1989. At that time, I was a medical officer, Yahya's medical officer. And then you mentioned the word earlier, glamour. And I kind of was taken up by the fact that here is a prime minister. And those days, to be honest, for a prime minister to have heart surgery in Malaysia was a big deal, was a huge deal. And credit to the entire then operating team for doing a fantastic job. But it got me thinking, hey, this is not bad. I have this kind of personality. I'm outgoing, I'm extrovert. I can be an ass if I want to. But, and this is clean surgery. I wasn't very much fond of body fluids and things like that. So you go into the abdomen, it can be very messy. But here it's only blood and relatively clean operation.
Okay, so wait, I'm going to pause you there.
Okay.
Because that's the exciting part, when you're really into that decision making.
Yes.
But you talk about med school,
sure.
And you talked about the SS Rajula.
Yes.
Which I've been on myself too.
Oh, really? We have a lot in common.
There you go.
Yeah.
And so I used to take that SS Rajula, and I used to go by bunk.
Same here. I went by bunk.
But I had one talent other than medicine, and that was to play the piano.
All right.
So I would go by bunk, and then I would go up to the first class lounge and play the piano.
Oh, okay.
So I would just go around, have their food, have their beer, and then go back.
Damn lucky, because I remember that I only made one trip on SS Rajula.
Right.
But you are given about 2 hours a day, I think, to go into the main deck.
Yes.
And so those 2 hours, otherwise you are at the bunk,
Yes,
and those 2 hours you go enjoy the breeze, enjoy the sun and everything like that. And my life would have ended there because there was this funny chap, maybe 10-year-old, 3 years older than me. I think he was bully by nature. And he actually tried to throw me overboard.
Serious.
And
so he obviously failed, right?
Yeah, he failed, luckily for me. And otherwise it would have been the end of my...
Really? Huh?
Yeah. So luckily somebody saw him trying to do this. And stopped him, and it became a big issue on that trip.
Yes. No, I mean, it was really fun memories. That's why I thought I would pause you there, because, when you want that bold white in color,
Yes, white SS Rajula.
SS Rajula.
After that, it was MV Chidambaram.
That's right.
But I didn't. By then, I was coming by air and all that.
Okay.
But I come from extremely humble beginnings. So I only had the opportunity to come back to Malaysia every second year. Because my dad couldn't afford to bring me back every year.
Right.
So it was remarkable that I had a very loving family in India. And then to come back and spend just 2 months of your summer holidays every second year with your own family, your parents, your siblings, was just awesome.
I'm sure.
It was just awesome. Yeah.
Well, okay, so we talked about that. We went into your surgical training.
Sure.
And then you happened to go into cardiothoracic surgery, right? As well as part of your rotation.
Yes.
And that's where it dawned on you that this is where I want to go. Is that the direction?
But to be very honest, it wasn't like I wanted to do cardiac surgery, blah, blah, blah. I wasn't sure what I wanted to do. I knew I didn't want to be a physician because I can't even till today think of more than 2 differentials for any diagnosis. So I wouldn't be a thinking kind of person. I was more of a doer. So I knew surgery was my calling. But what exactly, I wasn't sure. And then when this incident with the former Prime Minister happened, then I thought, hey, this is... And to be honest, I was very fortunate that the people around me thought that I had it in me to become a cardiac surgeon. Otherwise, I would not have been given the opportunity. Yeah.
Okay. I mean, this is telling, because during that neutral zone, if someone has finished their, I mean, your surgical career, it was cardiothoracic, and then what were the other disciplines that you rotated?
So I did orthopedics, general surgery, cardiothoracic.
Right.
And emergency. That was, I think you needed to do 6 months in each of these various things.
Right.
And like I told you, I didn't like abdominal surgery.
Yeah.
Though, J.C. Mehta was a fantastic
Yes.
general surgeon in those days,
Yes.
But I think the camaraderie and the fellowship within the cardiothoracic fraternity then,
Yes.
because it was very small. We just had one operating room in GHKL,
Yes.
and we used to do about 2 or 3 cases a day.
Yes.
And it was a small unit. We had 3 surgeons, a few of us, medical officers and trainees and registrars, and a couple of senior anesthetists, and just 3 ICU beds.
Right.
And I was very fortunate that I was there at what would have been the beginnings of cardiac surgery in the country.
Amazing, huh?
So even today, the fascinating thing about cardiac surgery is that a lot of the pioneers, they may be in their 90s, but they are alive.
Yes.
And if you talk to them, it is just a world of, I don't know what you call it.
I mean,
the thing is, that,
Yeah.
say, a lot of the abdominal operations, for example, designed 200-300 years ago. And the people who designed them are no longer with us.
Yes.
But there are cardiac surgeons who have designed various cardiac surgical procedures,
Yes.
who are still
there.
around, and we
Absolutely.
can talk to them and get the good vibes.
Yes,
and
yes. I mean, this
it's just
Westaby is still
amazing.
alive.
Yeah, it's a young fraternity.
Yeah,
The
right.
first open heart surgery was done in the 50s.
Yes.
So it's only today is 24. It's only 75 years old.
Yes, absolutely.
so,
When you talked about the general hospital and the single theatre, I remember doing my hernia operations. At that time, was a
Yeah.
senior medical officer, and I remember that very, very vividly.
Yeah.
That evening was about 11:30 at night.
All right.
And I was wondering what's going on in that room. He says, "Oh, it's an aneurysm. It's dissecting."
Oh, all right.
And I said, "So what's going to happen?" I
Yeah.
said, "Oh, they're bringing in." And that time was a new cardiothoracic had just come in
All right.
from Australia.
Okay.
So there was drama going on, and all that. That was
all
my first kind of thing, cardiothoracic surgery, and my eyes opened up, And then on the other side, what's happening? I said, "Oh, there's a plastic surgeon there." I said, "What's he doing?" "Oh, he's just doing an escharotomy," and that guy was just
all
slicing
right.
things. And I was going to do a simple hernia,
right.
and the local.
Yeah.
And so those humble beginnings,
Yes,
you tend to wonder what on earth is going on. And I got seduced into surgery right in medical school days, because the professor of surgery would come in for talks with a pipe.
Oh, all right.
And so he had this swagger, you would walk in with the pipe and what's happening,
Yeah.
Everybody all right? That kind of...
The surgeon in my medical school in India used to do ward rounds with a small flask, and occasionally he would used to take a sip. And we all were wondering, we thought it was water or something like that. Only at the end of the posting, I realized that it contained more than water. So that word swagger is very important.
Well, you're talking about swagger, right? Yeah, important. So go ahead.
Yeah.
And
So, I think you will notice that the personalities of various disciplines within medicine is sometimes quite obvious, isn't it?
Yes.
Physicians are of a certain type, surgeons are of a certain type, obstetricians and gynecologists are of a certain personality.
Right.
So personality is important, very, very important.
So on that score of personality, let me just read what Stephen Westaby has got in here in chapter 1.
Sure.
And he says here, if you search the internet for contemporary description of surgical personality, of the surgeon in a cardiothoracic surgery, it goes on, testosterone-infused swagger. All right? Confident, brash, dramatic, commanding, arrogant, volatile, even bullying and abusive.
Yes.
Abusive, aggressive. Cuts first, ask the questions later. Because to cut is to cure, and the best cure is cold steel.
Wow.
Sometimes wrong, but never in doubt.
Yeah.
Good with his hands, but no time to explain.
Sure.
Compassion and communication are for sissies. True and true?
True, I guess, but I think the world of medicine is changing. Today, that brash, arrogant cardiac surgeon still has to sit and explain the whole procedure. Otherwise, if things don't go according to plan, you will be in hot soup for not taking a proper consent or doing, something that the patient didn't expect you to do. So, of course, those were the glory days, but today I'm sure you'll agree, medicine has changed. The kind of roles that we have is not just unidimensional, it's multidimensional.
Yes.
And I think the single biggest advance that you see in medicine these days is the ability to communicate and to communicate well.
Yes.
Those days, like you say, cut and ask questions later.
Yes.
These days, you ask permission before cutting.
Yes, yes.
And you have to get the right permission. They have to know all the various risks and attendant morbidities and all that.
Yes.
So yes, but the personality is still
The culture
same.
hasn't.
The culture hasn't
it's,
changed.
It's
yes.
still that swagger, if I can
Yes,
put it,
certainly.
testosterone induced, not infused,
All right.
induced. You
Okay.
know.
All right.
And so I mean, I can feel it because when I meet up with my cardiac surgeon once a year for the last 13 years,
Wonderful.
I mean,
All right.
very calm, very collected.
Sure.
But I think if I were to have a conversation with you on a follow-up, it will take another hour because so personalities do play a part, isn't
Yes,
it?
it
And the
is.
choice of taking up this
Yes,
field.
yes.
Why? Is it because it's so highly stressed and there's
I
no
think-
margin of error? I would
I
think
think
so.
you took the words out of my mouth. Being a cardiac surgeon is not easy, all right? It is not easy to live with the fact that every case you do is a potential mortality, all right? The first step in a heart operation, the way most of us do it, is to connect the patient to the heart-lung machine.
Right.
That itself has about 3 or 4 possible areas where it can go completely wrong. So there are days when your heart surgery has gone wrong before it has even started.
Right.
Then, this whole question of keeping the heart still while you do your work on it.
Yes.
So what we use is a high potassium solution that stops the heart, and then you do your work. And unlike what some people think, we don't remove the heart out of the chest to operate. It's all there. We operate. But then the tricky part is to allow the heart to restart. That can sometimes not go according to plan. I mean, you can do a brilliant operation, but you see, medicine is an inexact science, isn't it? I'm sure you'll agree.
Yes.
So even today, 75 years after cardiac surgery has started, there are portions that we don't know very well. So once in 1,000 cases, the heart will probably refuse to restart after you remove the clamp and you want it to restart. And that's another drama.
Right.
And sometimes from that point, things can go downhill very quickly.
Amazing, isn't it? And
So
you have to have
the
that.
longest operation that I have personally participated in was 13 hours.
Right.
And in that 13 hours operation, a lot of time was spent in trying to get the heart to function again.
Yes.
The initial part in that particular patient, I remember, was okay.
Yes,
But
yes.
for some reason, the heart was not starting. And of course, there's a whole range of protocol for that.
Yes, yes. I was going to come to some of the hysteria that's involved in this this field.
Yeah.
And I remember you talking about 13 hours. I did one also about the same time.
Sure.
And this young man went through a windscreen injury, a head-on collision. And I think it's those kind of moments, long hours,
Yes.
where you're really pumped up and your
Yes,
skill
yes,
comes into
yes,
play.
yes.
And at the same time, patience that things will turn out well.
Sure.
So, for those who are listening in, surgical trainees or those who want to embark on a career of cardiothoracic surgery, what is cardiothoracic surgery?
Cardiothoracic surgery is surgery on heart and lungs, cardiothoracic. But it's more than that, obviously, all right? It is a long haul, all right? It's probably one of the disciplines with the longest tenure of training. So let me give you an idea of what I went through.
Yes.
All right. So I did my initial 6 months as a medical officer in HKL under Yahya. And then I went on to complete my fellowship. Then I was general surgeon for a year in HKL and while waiting for a posting. And fortunately, I managed to join IJN as IJN's first registrar.
Really?
So there were 2 of us, myself and a gentleman, Azlan Leong, who's still a very good friend, and he is in a private hospital in Malacca. So me and Leong were the two original IJN trainees. I trained for 3.5 years locally before I got a place in Australia for further advanced surgical training. And I trained at the Royal Prince Alfred Hospital in Sydney for 2 years. So it is 3.5 plus 2, 5.5. Came back in January 1997 and then was under supervision from January to August 1997. Supervision under various senior surgeons. And I was extremely fortunate to be promoted as a consultant in 1997 August.
So you're talking about medical school, which is about 5 to 6 years.
Medical school, 5 years.
5 years.
Housemanship 1 year.
1 year.
MO-ship 2 years.
2 years.
Basic surgical training 3 to 4 years.
Yep.
Cardiac training 5 years.
Right.
I don't know, you add it up, it's
time to rock and roll, man.
it's easily 10 to 12 years of training.
Years. Before you can actually do it on your own. Am I correct?
No,
you still have your fellowship program.
Training,
yeah,
yes,
sure.
yes. But before you are a confident, independent consultant, it takes that long.
Right.
And you and I know that paper qualifications are one thing.
It's people.
But, you need to be good with your hands if you're a surgeon.
Yes.
And that doesn't come overnight. So, you see, even if you are an FRCS or local masters or whatever, from the moment you qualify, I'm sure you'll agree with me, it takes another 3 years for you to hone your skills.
Yes.
So it is a long, long process, much longer than many other disciplines that I know. So for the young trainees who might be thinking of taking up cardiac surgery as a profession, put aside 10 years of your life.
Yes.
Yeah. Only then you will become a good, accomplished cardiac surgeon.
So if you look at that whole span of training, Venu, and you're into the cardiothoracic training program, which was the most difficult year? Was it the first year, second year when you enter in and have to understand the whole science behind it?
Personally, I found the year before I became a consultant to be the most difficult, because that's what separates the men from the boys.
Right.
All right. When you are young, you are starting, people are holding your hands, and of course you have to do a lot of reading, and training involves 16 hours a day. All that is okay. But when you are in the beginning, you can afford to have a little bit more fun because you are not that responsible. Then when you know that you are going to be a consultant and the buck stops with you.
Yes.
You might on occasion get help from a fellow consultant, but generally speaking, the buck stops with you. So I found my second year of training in Sydney when they told me that, okay, this is the last year of your training, you're going to go back to Malaysia, and so you better do what you're supposed to do. I found that extremely difficult because it not only built up my surgical skills, it also built up my character.
Yes.
And I think, I guess different people will have different opinions, but the start is always easy. It's the finish that I find very difficult.
Yes, because the onus is up to you now.
Yeah.
And at the end of the day, you got...
And I'm sure even in your plastic training, the early years or the years just before you became a consultant, you had a whole lot of worries because, you don't want to do the wrong thing.
Right.
And you want to be right by the patient. And I
agree with you there because, my general surgical training, I wanted to get out as fast as I could because there's no way I could join two pieces of gut together. And so I got out and I packed my bags, resigned from government service. I had 3 boxes and I went all the way to England to do plastics.
Oh, all right.
Yeah, so that was the cost that I
Where did you do your plastics?
Well, I had 3 postings. So it was in Edinburgh, and then in Cambridge, Edinburgh, and then in Frenchy, in Bristol. So there were 3. But at that time, in the 1986, 87, there was no formal program.
Sure.
Today they have a program. So you're literally hopping around, picking up skills.
Sure.
But the most challenging, of course, and the one that was most pumped up was when I had to go to Sabah and start the first department of plastic and reconstructive surgery.
Oh, amazing.
So that was when your skills start honing in and you become responsible.
Sure.
And I found myself in cleft surgery. You see, sometimes you find yourself when you're doing, who you are.
Certainly.
And if you're a creative person, you want to see a child coming in with cleft and how they look up. And I see some of them now after 25 years. Young, in university today.
Yes.
And you wonder, what the hell did you do? That kind of thing.
No, I think any discipline in medicine is rewarding.
Yes,
right?
Absolutely.
And which is why, there's this whole debate whether medicine is a right or a privilege.
Yes.
Medicine to me is a right. Some of us may be outside the public sector now, but we have all contributed at some point towards the wellness of the population, to the health of the average Malaysian. All right? And I think that's important.
Yeah, I mean, well said, and I mentioned about this whole space. I call it a holy space. Because there is the source of life, isn't it? Everything is there. And the dexterity of the angles that you have to turn the forceps and the needles, a 3/8 or 5/8 circle. Thoracic surgery is a different kind of ballgame, would you say? I mean, personality-wise,
I mean, I think you have to probably distinguish between cardiac surgery and thoracic surgery. Cardiac surgery is, of course, all about precision. If I'm doing a coronary bypass, and eventually if I have to put 100, 200 stitches together to construct all the grafts, not one stitch can go wrong. Because if one stitch goes wrong, things can bleed, bleeding can lead to all kinds of other issues, and it can lead to an adverse outcome. The challenge in thoracic surgery these days is that it is becoming increasingly minimally invasive. Nobody does those big scars anymore. It's all through a thoracoscope, maybe what they call uniportal Vadis and things like that. And those are a completely different set of skills. So the older generation like us probably can do both. But in the UK and in the US, thoracic surgery is now a separate specialty. And to be honest and to be fair, there have been tremendous developments in thoracic surgery. So two different spectrum of skills and knowledge and maybe personality too. Because the thoracic surgeons nowadays, the real full-time thoracic surgeons, think that cardiac surgeons are useless. Cardiac surgeons think that thoracic surgeons
No wonder they're separate now. But I mean, the brain must be wired differently, isn't it? I mean, one is,
isn't it?
Like we have plastic and reconstructive. So would you think that there's reconstructive and there's deconstructive? I mean, you're building a pipeline and getting the highway going. And the other one is lung cancer, for example. You've got to take everything down and find out what the hell's gone wrong.
And to remove a whole lobe of a lung through a small incision using cameras, I tell you, it's not easy.
I'm sure.
It's not easy.
So this is why.
And I personally am more of a cardiac surgeon than a thoracic surgeon. But many years ago, we decided to work as a team. So right now in the hospital where I work, there's somebody who's very good in thoracic. I'm fairly capable in cardiac. And so we marry our skills. And in the end, we hope that the patient gets the ultimate benefit of all the years of our experience.
How it has evolved over the years as you get more and more.
Of course, both of us, our current team, both of us do both heart and lung. But, the skills are different. And we respect each other's, a team is not just two people, four pairs of hands. It is much more than that. There is a certain philosophical and ideological cohesion
which is critical.
Which is critical. And I am very, very fortunate that every time I need to be in the operating room, I have somebody who I know I can lean on. and he knows that he can lean on me.
Yeah.
You know,
It's
and that is
amazing.
very important.
Amazing.
It's like having two pilots in a cockpit.
Yeah.
You know, I'm sure one pilot can fly the plane.
Yes.
But it's always better to have two.
And you'll never know when the turbulence comes in, and you don't know whose
your
belt
plane-
to fasten. You know?
Yeah, 178 feet in 4.6 seconds. That's
Really?
what happened to SQ321.
Yes. I mean, it's amazing, isn't
And
it?
by the way, I'm a huge aviation enthusiast.
Is that right?
Yeah. So
Well, I must tell you, when I came from Kota Kinabalu this time
Uh-huh.
on Malaysia Airlines, nobody went to the toilet. They had their
all seat
belts on, and I'm sure some would have worn Pampers at the same time, you know, because the trauma of anything happening, which is really interesting. But so when you want to do a thoracic, is that a separate fellowship, or is that something you glide
No,
into?
in Malaysia it is still the same, but in many Western countries, thoracic surgery comes under the ambit of general surgery. So it's usually a branch of general surgery.
Right.
Cardiac surgery is a separate individual specialty.
Right.
But, you know, we are a young nation.
Sure.
Our specialty is just growing, probably in its adolescent years now.
Yes.
So in Malaysia, still, even the junior surgeons who are coming up are expected to do both heart and lung.
Yes. So that's very important, isn't it?
Yes, it is.
Because you know, we talk about the dexterity of both, and especially with lung cancer going up so much,
Yes.
increasing. So obviously, there's more need for.
And in lung cancer, there is also much earlier diagnosis these days.
Yes.
So the tragedy about lung cancer 10 years ago was the fact that, you know, people used to come very late into the disease.
Right.
And very often they were not resectable, not operable.
Right.
But today with early diagnosis, and lung cancer is one area where the pharmacology, the chemotherapy and things like that has improved tremendously. We have these drugs called targeted therapy drugs, and they will ensure that a stage 4 lung cancer can have 3 to 4 years of not just life, good quality life. Yes.
Yeah. Well, this is the end point.
Yeah.
Isn't
So
it?
lung cancer has come a long way, both in terms of surgical resection and the supportive treatment.
Fantastic.
Yeah.
So when you look at the whole spectrum of your journey, and you're talking about some of it is cerebral,
Of course,
and
very,
you know, and the rest of it is just your pure you know, practical part of it. In the growth of a cardiac surgeon in his expertise, is it also a good place to have some academy involved in it? That means if you join a university and you're teaching, like you are
Yeah.
a visiting lecturer to several universities. I mean, you have. I mean, if I'm a medical student or I'm in the university and I'm listening to a surgeon and he's teaching, he obviously knows his work.
Yes, certainly. Yeah.
To teach.
But I must reiterate that I don't teach cardiac surgery.
Sure.
My teaching appointments are for final year medical students.
Yes.
But it keeps me young.
Yes.
And it keeps my basics very solid.
Right.
Because they ask those kind of questions. And to me, it is very, very important that your fundamentals are right. Yes. So you need, like you say, a cerebral journey. And the skills very often are from an apprenticeship, isn't it? I'm sure, you know, there were surgeons who taught you the intricacies of reconstructive surgery. You can't read that from a book.
No.
You can't even practice on a mannequin.
Yeah.
So that is why I personally feel that surgical specialties, irrespective of what specialty, is still an apprenticeship.
Yes, absolutely.
And so you have to marry academics with apprenticeship.
Yeah, absolutely. I mean, I agree with you. I mean, I had a professor in Cambridge who would come in here as a surgeon, plastic surgeon. He'll come in, he'll cut the whole tumor out. They say, "Okay, Charles, close it," and then he'll walk off.
It's the same story. When we were registrars, you know, the chief surgeon would come do the operation. Patient will be welling up with blood, and all he'll tell you is, "Venu, close." And then I'm there for the next 4 hours trying to get hemostasis and get the sternum together. But that's what separates the men from the boys. I mean, if you at that stage in time couldn't close that lesion, You wouldn't be the kind of plastic
I
surgeon you are today.
Yeah, I mean, the holes would have been different, you know. But, you know, the whole concept of thinking through.
Yeah.
But, you know, this whole work-life balance that people talk about. I mean, there's a cost when it comes to cardiac surgery.
Sure.
And but I'm more interested, you know, when you talk about work-life balance and people talking about, you know, make sure that you have a family life, a balanced life. Yeah. But I want to go into the whole equation, because if you just talk about work-life, it's a plank.
Yes, it is.
But there's a fulcrum in the center.
Yes.
And for me, that fulcrum is spirituality.
Sure.
The spirit man of every surgeon or anybody who's doing a profession will keep the person in check, grounded, and molded.
Yeah.
Now, recently you had an audience with His Holiness, the Dalai Lama. I mean, how important? I mean, talk to us. I mean, share with us that moment.
Well, you know, to be honest, I am a devout Hindu.
Yes.
Practicing Hindu. But I spent my entire schooling in a Christian missionary institution. So that was about 10, 11 years of my life. And like I said earlier, the two best professional years of my career were in Regiment Askar Melayu di Raja.
Right.
So I have been extremely fortunate to have been exposed to all the major religions, or the three big religions in our country. And honestly, there's no difference. Every religion talks about wanting to help others, wanting to do good, do no harm, which is again part of medicine.
Yes.
All right? So I have always respected every other religion. And you know, I've always kind of respected His Holiness the Dalai Lama as an individual.
Yes.
Because of what he has done, because of the life that he has had to endure. He was forced into exile at a very young age. And his teachings are very simple. How to be happy.
Yes.
His whole thing is about happiness, nothing else. And to me, it was a huge revelation that in today's world, in today's troubled times, there are avenues to be happy, you know. So what I did was, I have a friend in Bhutan who's a Buddhist. I went to Bhutan 10 years ago. And for 10 years, I never thought of him, but we had maintained WhatsApp contact and all that. So I called him one day and said, "Hey, Sangye, do you know anybody in Dharamshala?" He said, "Why?" He said, "I don't know, I have a calling, I want to meet the Dalai Lama." Then he says, "Hey, I know the secretary, he's my classmate."
Wow.
So you see, it is more than just a
destiny,
coincidence.
Yes.
And so from there, things worked out. And I had the most humbling, most amazing 2 minutes. It was just 2 minutes. But being in the presence of somebody like His Holiness, who's not even from my religion, it was just awesome.
I'm sure.
And I would do that again anytime
I'm sure.
I get the opportunity.
When you talk about it, it's better to be happy than to be right all the time.
Yeah. You talked about spirituality. I have a guru, a Hindu guru. But the way I came into contact with him is just unbelievable. You see, in 2008, I had operated on an individual who happened to be a devotee of this Swami Bhumananda, we call him. And so he had introduced me because Swami Bhumananda comes to Malaysia once a year. Then in 2008, I had a medical issue. After a while, I just wanted to, because I lost my parents when I was relatively young. You can't keep talking to your in-laws for more than, a certain number of times. So I just needed to lean on somebody. So I thought of this patient and I said, "Hey, Jaya, the Swamiji you introduced me to, how do I get in touch with him?" And he said, "Why, doctor?" And I said, "No, it's something personal. I would like to speak to him." And he says, "Hold on." Can you imagine, Charlie, that the day that I made that phone call, this Sri Lankan individual who had never been to Kerala before happened to be in the ashram standing next to the Swamiji. And he just handed over the phone. And then that Swamiji and me, we had a half an hour conversation. And that was the beginning of my journey into spirituality.
This is destiny, isn't it?
It is destiny. And I like what the Guru said. You know, Guru-Sishya relationship. I remember him telling me, a lot of people think that we Sishyas look for a Guru, all right, or a teacher. But sometimes it's the other way around.
Yes.
Gurus also look for good Sishyas. So I don't know what it is, but and I must be very honest with you, from the beginning of my spiritual journey, I have nothing to complain. Life has been very good to me.
Yes, yes. And I'll take you a step higher.
Okay.
And that is, I mean, there would have been times, you know, as in surgery, you know, when things have gone wrong.
Yes, certainly.
And one look at the surgeon coming out of the operating theatre, he's got his face down, his gloves have come off, the mask, the way you take off the mask, you know that, you know, it's not been that kind of a good.
Yeah.
I want to ask you, those kind of moments where things have gone totally wrong, do you question yourself, is there a God?
That's a very interesting question.
So I've taken you to the highest way. Because
that's a very interesting question because I have decided that there is a God.
Right, amen.
It might not be that individual kind of God that we look up to, but there is certainly a higher power. And I'll tell you for the simple reason. There are days that I think I have done a fabulous job in the operating room. Patient comes back to ICU. 3 hours later, he's bleeding. 3 hours later, he's got arrhythmia. And things can go terribly wrong. But I think I've done a fabulous job. Then there are days that you honestly think, I'm sure it happens with you too, that I could have done a better job.
Oh yes, all the time.
Yeah, could have done a better job. And then you visit the patient in the ICU next day and he's saying, oh, thank you so much. So I decided after 2 days in the ICU that there are so many things that are beyond our control.
Amen.
And just for that one reason, I do believe there is a higher power. And if things don't go according to plan, my only consolation is that I have done my best.
Yes.
And sometimes, you know, I mean, I cannot be or you cannot be in charge of somebody else's destiny, right? So maybe that patient had reached that particular stage in life. As long as I know that I have given my very best and I go all out to do that for every single patient, if things don't go according to plan, serah kepada Tuhan, you know.
You know, in closing, as we come to the end of this fantastic conversation with you.
Thank you so much. Thank you.
The finality of death is a real possibility.
Yes, certainly.
You know, Woody Allen, famous, you know, he's a comedian, actor. He was asked this question.
Okay.
What are your views on death? And he said, I don't like it. as if there was an option.
I mean, it's the only certainty in life.
That's right. You know?
It's the only certainty in life.
Absolutely.
If you're born, you die.
Absolutely. And you know, and so the night before my open heart surgery, I knew that death was a possibility.
Sure.
And I wrote 3 letters to my children.
Oh, all right.
And addressed it to them of what I would want them to be.
Sure.
If I don't make it.
Yeah.
And it was a very, a very trying moment. And my son, Jeremy,
should have been very emotional too.
It was very emotional, but my spiritual anchor.
Mm-hmm.
In fact, the cardiothoracic surgeon who is now in Penang prayed for me.
All right.
And so prayer was central.
Sure.
And before I entered the operating theatre, the head nurse was there and she came and prayed for me. So, you know, and I'm writing a book on my memoir, which is called ICU.
Okay, ICU.
You.
All right.
And the spiritual part of it was that I was arguing with God, you know, really having a conversation for 2 weeks. I was given 2 weeks to get everything in order.
Oh, all right.
Yeah. And so I said, give me a sign that you are with me.
Okay.
No sign.
No sign.
Venu, nothing, right? Till the last moment, I had this yellow uniform on me, gown, and had my headphones all set.
All right.
And and then they were wheeling me, on the bed, taking me to the operating theatre in IJN, the heart center. And it passed by the intensive care unit.
Oh, all right.
And I looked up and I saw the initial ICU.
All right.
I caught that and I said, all right, God, your eyes on me. And the anesthetist came in and said, "Are you ready?" I said, "Shut the heck up and get it on." You know? So there is that spirituality at the end of the day that holds, thing. And so I started off with this question, and I'm going to close with it. If you had to do it all over again, would you have still chosen cardiothoracic surgery?
That's the only thing I have done in my life as an adult doctor. And as I mentioned earlier, the field has been good to me. I would certainly do it all over again. But it's not an easy ride, And I think if this conversation is also in a way to inspire future potential cardiothoracic surgeons, I think it is our duty to highlight to them that the journey can be bumpy.
Yes.
All right? Training itself is one, obstacle. Building your personal capacities, your individual character traits, that's another whole journey. Living to the expectations of your patients, that's the third thing. Not easy. But just imagine there's a patient on the verge of saying his final goodbyes, and then you bring him back.
Absolutely.
Give him another 20, 30 years.
Yes.
I mean, nothing more rewarding than that.
Yeah, absolutely.
Absolutely nothing more rewarding than that.
That's
2 weeks ago, see, I became a consultant in 97. So it's about more than 25 years that, So 2 weeks ago, I was very pleasantly surprised when a patient just walked into my Pantai clinic and just said, "Dr. Venu, you operated on me 25 years ago. I'm celebrating my anniversary."
Yeah.
And I thought I would say hello. I mean, that is reward.
Yeah, absolutely.
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 So
this is where the juice is worth the squeeze.
Certainly, you've said it very well.
At the end of the day, it's in closing some positive notes, because today there's much in the news about training of doctors who want to become cardiothoracic surgeons. Sure. So what's your final closing words for those who are anxious on embarking on a career and they are stuck with this whole problem that is going on today in this country? And we are moving so fast into technology, there's engineering, there's bioscience, AI coming in. I mean, there's so much ahead, and we're just so early, embryonic stage. What are your closing thoughts to those who are listening in, that there must be a light at the end of the tunnel?
No, I honestly think today cardiac surgery is no longer a vocation. It is a calling. We have moved away from the profession of medicine to the industry of healthcare.
Right.
With its various challenges. But good old-fashioned medicine treating a sick individual still has its rewards. But you have to persevere. You have to be prepared for the journey. You have to build those character traits that will hold you in good stead. And I think whatever is happening in cardiothoracic surgery from the training point of view, like you mentioned, is a very transient thing. I personally think it is a purely professional issue that should never have been highlighted into the kind of mudslinging festival that it has become.
Yes.
It was a professional issue that should have been sorted out by professionals. And I guess the good news is, going by yesterday's cabinet statement, I think there is a light at the end of the tunnel.
Yes.
So the training issues will be sorted out.
Yes.
But you have to be honest with yourself. I tell this to every medical student, to every potential cardiac surgical trainee. Do you really want to do that?
Yes.
And nobody else can answer that question. And again, I became fond of cardiac surgery only during that tough second year of my training in Sydney.
Yes.
Before that, I wasn't very sure what I was going to do and whether I was in the right place, whether I was doing the right thing. But at some point in time, the knowledge will dawn on you. So yes, if your calling is that you want to be a cardiothoracic surgeon, go for it. These training stumbling blocks will soon be removed. And I'm sure there's no journey like mending broken hearts.
Yeah,
you know?
that's right.
I mean, if I may, I want to end up with a quote.
Yes.
And this is my favorite quote from my holy book, the Bhagavad Gita. And the Bhagavad Gita says that every yesterday is but a dream, and every tomorrow is but a vision. But every today well lived makes every yesterday a dream of happiness, and every tomorrow a vision of hope.
Well,
So
fantastic.
so I remember that quote every day. I carry it with me. And despite whatever is happening, our country may be at crossroads, our profession may be at crossroads, but there is always a path, and there is always light at the end of a tunnel. But like somebody told me, just make sure it's not the headlights of an oncoming train.
Yeah, well said, and such a note of caution too, that and allow me to end too, that at the end of the day, we are at the mercy of our Creator, that we are fearfully and wonderfully made.
Yes.
And His works are marvelous.
And He doesn't distinguish.
Yes.
So I think if the country is to move forward, I think we have to kind of have a shift in paradigms.
Absolutely.
And understand that we are all one.
Yes. So on that note, thank you for joining us on Heart Talk. I hope that we have spoken to your heart. And if you're a budding surgical doctor who wants to do a cardiothoracic surgery, you've heard it from the man himself. Remember, you can always mend a broken heart with the right doctor and the right attitude. So once again, we'll talk, and thank you for joining me on Heart Talk.
It's been an absolute pleasure
it's
and honor.
been fantastic.
Yeah, thank you so
And I
much.
hope I have another, many years more to see you.
All right.
And if
those occasions will be in pubs.
Absolutely, that's right. Now that's a different kind of juice, worth squeezing.
No, but I must say I was a bit apprehensive about this conversation.
Sure.
But I have enjoyed it, and I hope you did.
Oh, absolutely. And so, we'll talk again.